What's the true definition of value in healthcare? When we talk about value-based care delivery, what's the value we're referring to? The answers to these important questions might surprise you. Let me tell you first what value in healthcare is not. Value in healthcare is not meeting population and documentation metrics that may or may not benefit the individual patient. That's metric-based care. And while for now it may generate some secondary revenue from payers, for the individual patient it can be worse than useless. No, the true definition of value in healthcare is surprisingly simple. Value is whatever the patient, the purchaser if you will, says it is. So what do all patients want, regardless of their conditions, their treatment plans, or their outcomes? They all want a trusting relationship with a personal clinician who's accessible and who can advise them on the appropriate course of action, tailored to their own individual needs. One who's also empowered to coordinate their care through this increasingly complex world of healthcare delivery. Give your patients that, and your cost of care will fall through the floor. The trusting relationship between patient and clinician is the heart of every successful value-based care model. I'm going to repeat that point because it requires a dramatic departure from the current groupthink. The relationship between the patient and the clinician is the absolute core of a successful value-based healthcare system. Anything that promotes that relationship is good, anything that degrades it is bad. No exceptions. I've spent nearly 20 years developing the best approaches to the delivery of value-based healthcare. Today, I help clinicians and healthcare organizations leverage value-based care by helping them build trusting relationships between patients and their own personal clinicians. Fully engaged clinicians, systematically delivering tailored, patient-centered healthcare using appropriately aligned financial incentives, consistent feedback, and comprehensive education on care delivery, contracts, and compensation. I provide them with an understanding of how practicing under a value-based care model is completely different from the production-based fee-for-service system that they're used to. I help them recognize that even the patients with the greatest disease burdens can be cared for successfully and sustainably, presenting the greatest opportunities for professional fulfillment. I even help already successful systems prepare for the reduced capitation rates that are sure to come. These crucial components of value-based care delivery all strengthen the bond between clinician and patient, and thus strengthen the value of the health care you provide. I'd love to hear from you. Let's discuss how together we can unleash the power of value-based care to meet your challenges and generate tremendous value by focusing on what your patients, your customers, truly want. Healthcare that is nothing less than exceptional.